This yesterday, you saw the KMTC had their 87th graduation ceremony. They have been around for a long time, churning out health practitioners that have been enabling our health sector in the country. And to have this very important conversation in as far as how this is being done and how it has had direct impact to you and I is Dr. Kelly Oluwoj, who is a Deputy Director, Finance, Planning and Administration at KMTC. Thank you for your time. And Terry Jepchirchir Chelimo, who is a physical therapist and a women health or pelvic floor specialist. You'll tell us more what it is that you do. Thank you for making time. Are you an alumni of KMTC?
Yes, I am an alumni.
Excellent. So that means we are actually walking the talk, yeah? Yes. So we saw many professionals, of course, sent out into the system to ensure that they not only are part of the universal health coverage that we're trying to achieve, but to also capacity build the system, because that's the one way we'll get to achieving UHC. We were just earlier talking about the dire situation in as far as the blood shortage is concerned. How has KMTC helped in that front?
Okay, thank you, Gladys. Perhaps the public needs to know what KMTC is.
Yeah.
KMTC is a semi-autonomous government agency under the Ministry of Health. It was started in 1927. It's been there all this time, and we were glad to have our 87th graduation yesterday. KMTC over the years has grown in size. Just to give you a small picture about how much we've done, in 2013 we had 28 campuses. Right now as we speak, we have 71 campuses spread across 43 counties in Kenya. The only three counties that we've not gone to is Samburu, Narok, and Marsabit. And we are having plans to make sure that we at least have a campus in those three counties. KMTC plays a very big role when it comes to UHC. First, because our trainees are at the grassroots level, at the community level. We ensure that our training is skill-based, and that means that we want to ensure that Kenyans receive treatment basically from the community level, and our trainees go to that level. About yesterday, Gladys, we were glad that we were able to graduate 12,261 graduates yesterday. That is a big step when it comes to UHC. Because to us that means that a mother will no longer die of unskilled delivery at the village level. When it comes to blood donation, of course, our campuses spread all over the country are engaged from time to time in marshalling students to be able to donate blood to ensure that our hospitals have blood that is life-saving. You know, we cannot buy blood, but because our campuses are spread all over the country, we're able to marshal students and staff to be able to participate in blood donation. Yeah.
Okay. Now, away from that, you talked about over 12,000 professionals that graduated yesterday. What professionals exactly are we talking about?
Okay, thank you, Gladys. KMTC trains in health sector.
Yes.
We are the main training arm of the Ministry of Health. Over 85% of mid-level health professionals are trained in KMTC. We insist on competence. And when we talk about this, we have 17 diploma courses, and we have 44 post-diploma courses. We also have several certificate courses. Collectively, we have 76 courses being done in KMTC. These run from nursing, pharmacy, occupational therapy, physiotherapy, optometry, name anything about health training, KMTC does it. Yes, and we don't stop at 76. We consistently ensure that we address emerging and re-emerging health conditions by developing curricula to address new challenges that come in the health sector. Okay. Gladys, you are aware now that currently we have a challenge when it comes to cancer treatment. we have developed curricula and are implementing courses to do with palliative care and oncology to ensure that people who are suffering from cancer have access to skilled healthcare. Yes.
Now let's bring in Terry, who definitely is a beneficiary of the training that happens at KMTC. How long have you been practicing as a physiotherapist?
Not very long. I just started this year. This is December will mark my first year in practice.
Excellent, well done. And what has been your experience considering the skills that were given to you and the job market?
The same, beneficial in terms of what I was taught in school is what I'm actually applying in the field right now. And when it comes in terms of physiotherapy, I did mine in KMTC Nakuru. Did my diploma in KMTC Nakuru. So we do like just a period in class and most of the time in the practice in the hospital. So it has been beneficial for me. Yes.
And for the patients, because physiotherapy, of course, comes in handy for different types of patients, but some of them, and I think this is one of the gaps in the system, is that they cannot afford it. Have you found yourself in a situation where you want to help, but it's beyond you?
Yes. Sometimes you just do what you have to do, because at the end of the day, it's the quality of life of your patient more than the money that you are looking for.
But your employer might not agree with that, right?
Yes. But you see, for physiotherapy, there's treatment in hospitals, then there's domiciliary. So there's home visits. So in case a patient is not able to afford the fee for hospital, they are advised to go for home visit. And now that on home visit, now you can deliberate with your patient and, reach a certain level that he or she can pay.
So bringing the care to the patients.
Yes.
Okay. So, Dr. the relationship with the counties, I'm sure, needs to be one that is good to ensure that you help them capacity build because of the health workers that you churn into the system. How does that look like now that health is a devolved function?
Thank you so much, Gladys. As I mentioned before, we are in 43 out of the 47 counties. And I must take this early opportunity to thank governors who've collaborated with us. I want to be very specific about the kind of resources that the counties have been able to put in KMTC. We are talking about resources that are close to 1.2 billion shillings. And this is in terms of infrastructure. It's in terms of land, provision of human resources that will do the training in these areas. Governors and counties also provide areas for training. Right now we have 451 sites for training, and basically this is all over the country, and the counties play a very big role when it comes to this. When it comes to collaboration in terms of training, counties play a big role. It is through the counties that we are able to do what is called training needs assessment. What is really needed at the county level? You realize that counties have different health needs.
Yes.
For example, Machakos will not have the same health needs like Kisumu, for example. And so from the training needs assessment, KMTC then develops curricula that enable these counties to overcome health challenges at that level. We do not want to generalize and say that all counties have the same health challenges. And therefore we ensure that we address these challenges in collaboration with counties as they emerge. Another issue about how we collaborate with counties is through training sites. You know that KMTC, part of the training happens at the hospital, because we want graduates that are able to immediately enter the job market and be able to perform. And for this to take place, you need skill-based training at county health facilities. And this requires that we have preceptors at the level of clinical care. So counties, through the human resources for health that are available in the county, act as preceptors for students who are attached to these facilities. And we really want to thank the counties. Don't want to forget the CDF, the National Government CDF. We have across the country MPs who've come along to help us to develop infrastructure that is very necessary for the expansion that we've done. For us to have an expansion of 34 campuses over a period of 7 years, you realize that collaboration has to take place, because we do not have a lot of resources at our disposal. So we leverage on this by engaging the counties, by engaging the CDF and other partners who have been willing and have come across to enable us to train and to ensure that our country has skilled health personnel to be able to address health challenges that we face from time to time. Yes.
Now, Terry, one of your other specialty is pelvic floor. What is that?
KMTC, in collaboration with some
international universities,
yes. Brought up a curriculum earlier last year, late last year, early this year, yes, for women health rehabilitation. So it trained 30 women. We're only 30 pioneers, and we're the first cohort. So women health is majorly a non-invasive method of treating and improving the function and strength of the pelvic floor in regards to the pain, in regards to the discomfort, and it involves conditions like incontinence, vaginismus, prolapses, fistulas, name them. Yes.
Exactly. And fistula is a huge problem.
Yes.
All right. So how now exactly do you work with the counties to ensure that your skill set is felt across board? Because this is a great need.
Yes. I've been in one project for KNH, Kenyatta National Hospital. They did a VVF project for women, so they paid for several women. The government paid for sessions for women to come to hospital and get checked. So as a physiotherapist, you're in a position to assess, treat, and follow up with the review, and even give home exercise programs. Yes.
Okay, now, Dr. Kelly, I'm just listening to Terry, and she sounds equipped to do what she needs to do, and she definitely is a great add-on to the health sector. But the country has over and over again dealt with a lot of strikes because they go out in the market, we don't pay them well, and before we know it, brain drain happens and we lose them to other countries. How are we ensuring that, even as you work with the government and the county government, that we keep the resources that we are churning out into the system?
Thank you so much. KMTC, first of all, does not only train for Kenya. We train for international market. You go to US, you'll find a KMTC graduate. You can go to Canada, you'll find a KMTC graduate. You go to UK, you'll find a KMTC graduate. Just back to the health sector, we have had challenges when it comes to strikes and human resources for health in counties. In respect to this, it sometimes affects training, because we depend on those human resources for health at the county level to make sure that our students go through skill-based training. What we do at our level to ensure that our students are ethical and be able to take care of patients and not put money first is to ensure that as students come into KMTC, we inculcate the culture that life is precious, the sanctity of life. And through the training, we ensure that our students are ethical in their behavior, in their practice, to make sure that when they go out there, they're able to instill the same values in the workplace. So what we do is to follow up students and to make sure that we have proper discipline among students. And when they go out there, you will realize that the cadre of staff that emerge from our training from KMTC most of them do not go through a lot of industrial actions when it comes to the job market. Sometimes these are inevitable circumstances that may be addressed by the general national government. But from our perspective, we want to always make sure that our students are ethical, they know the sanctity of life, and they know that the life of that patient depends on them at that particular point in time.
But you've got to be practical. They are living in a world where the economy is across the board. It's affecting us across the board. So if they are not taken care of, and this is a great investment you put in this one student, do you behind the scenes lobby for the better payment of your students or your workforce?
Gladys, you know, our mandate is training.
True, but the sustenance of the same is important.
Of course, but you know, in health sector and in professions in health, money does not come first. Sanctity of life comes first, and our role in this is to ensure that our training instills on our students and the later workforce the fact that money is not the solver of all problems. First, we must make sure that we have a system that respects the patient. We, of course, collaborate with counties to ensure that there is a proper work environment for our graduates when they go to the work environment. We may not negotiate directly to ensure that they have a better pay, but we equip them with skills that does not just make them be employable in a regular public sector. We enlarge their skills. We enable them to be thinkers. We enable them to be, for example, Terry is not only a physiotherapist, she has gone further to develop herself in other areas. And so basically we are not just training employees, we are also training employers, and we don't just want to discuss the issue of wage. We also want to ensure that our students are able to create employment and to get out of this rat race of just making sure that you get a job and negotiate for a pay, and if the pay is not good, you either go out of the job or all that. So what we want to do, we always do, is to ensure that our students through training are open-minded. They are lifelong learners. They don't only depend on employment at the public sector. They can go to the private sector if they feel that the employment at the public sector does not remunerate them enough for the skills that they have.
Okay, now Terry, it has been a year practicing out here, and we're talking about UHC being a success story, at least in the 4 pilot counties, and by June of 2020 it will be rolled out into the other counties. What are some of the gaps you found in the system that you think should be, you know, looked at even as we gear up to roll out across the country?
Okay, if in regards to my profession, there's a lot of very young physiotherapists who have come into the market, and they're still coming, like the graduates, the class of 2016 that graduated yesterday. So for me, I feel like the young people, the treatment and the I feel like for the young physiotherapists, they need to be created for more room to, you know, so that when they finish school, it's not a matter of you've given up, you do not know where you're going to go henceforth. So there should be like things like, you know, internship programs. I feel like they should incorporate, because many young physiotherapists are not stable, and many people who have done physiotherapy who are now the employers, they're definitely doing well, but then there is a large gap that has been left out for the very young physiotherapists, which I feel like they need to consider the young people. Yes.
Okay,
Yeah.
and I think, Dr. Kelly, that's the sustenance we were talking about. You've invested in this student, you've sent them out into the workforce, but there is nothing, no one to absorb them. What next? That can be very frustrating, which now informs the brain drain. They
Yes.
leave the country for greener pastures, right?
Yes.
So we need to equip our country, even as we're talking about UHC, right?
Yes.
Yes, thank you so much. In terms of UHC, KMTC is a very key player. Out of the 7 pillars of health care, human resources for health remains pivotal to ensuring that UHC succeeds. And this means that training must be available in enough quantity. That means we must be able to provide infrastructure to enable training to take place. Secondly, the quality of training must be that assures that the patient at the end of the day gets the highest level of care as per the Constitution Article 43 Part A. What we are doing in terms of ensuring that UHC succeeds and KMTC is a key player is first to ensure that our students are attached at local facilities. I mentioned earlier, Gladys, that we have 450 health facilities, public health facilities, where our students are attached, and they provide direct care under supervision of preceptors and supervisors in the clinical area. That is one way in which we extend and alleviate the human resource shortage that health facilities face from time to time. Secondly, at community level or at rural level, we have programs that reach out to communities at the local level, where communities are trained on basic hygiene, hand washing, immunization, and other things that affect public health. Again, we have a program where, you know, in health training, after the going through the main training, there's usually an internship period, basically spanning a period of around 1 year. This period enables a trainee to farm their skills, especially the practical skills in a clinical setup, that as they farm their skills, they also provide service. The government has developed a program where interns are being compensated for the services that they deliver in these areas. I believe that with more plans, the Ministry of Health, in collaboration with KMTC, will be able to ensure that challenges that are being faced by our graduates, like Terry here, will gradually dissipate, and we will ensure that there's a smooth transition from training to service provision in a way that does not impact negatively on the skill base that we have in this country. We also do not want most of our trainees to just go out of the country and leave our population vulnerable. And so we want to make sure that the environment is conducive, the environment favors absorption of our graduates, and to make sure also that our graduates are competent and they are the most preferred in the marketplace.
Okay, so Terry, many graduates yesterday into the job market, and as you're saying, there are some teething problems as you're trying to get absorbed into the system. But even as you go into your profession, physiotherapy, to start with, why did you even go there? Why physiotherapy and not any other skill?
Well, I finished school from Pangani Girls.
Yes.
And I got a B+, but then I wanted to really do medicine. So because my cluster points couldn't make it for universities like Moi University and all, I had to look for I was asked by my auntie and my mom to get a technical course. So my parents were in for a technical course that is marketable both in Africa and internationally. So that's why I picked physiotherapy, because I was very sure that after school I could employ myself even before I get employed, which is what happened. Yes.
And of course, physiotherapy is just one amongst many other courses that KMTC offers. And now that you know what KMTC has to offer, though you wanted to go to a university, would you recommend somebody else go to KMTC?
Definitely, without a doubt, because I have been in school for when I was reporting to school, my admission letter read 3 years, and it only took 3 years for me to do my diploma. There's no thing like strikes and all, so that assures you that if you have plans for, you know, your future, if you're sure you're only spending 3 years in college, that's the 3 years you'll spend, and they will make the most of you while you're in school, because we do classes from 8 to 5. Yes.
Okay, and Dr. Kelly, even as we wrap up this conversation, you just graduated to over 12,000 graduates. When is the next intake, and what is the criteria? What are the minimum requirements to join KMTC?
Okay, KMTC, I want to say, is offering opportunities to all Kenyans. The minimum entry grade for somebody who wants to do a certificate course is a C-. Of course, because our courses are science-based, we would lean towards mathematics, chemistry, biology, and when somebody wants to do a diploma course, the minimum grade is a C plain. To ensure that Kenyans access training in KMTC, we have opened help desks, admission desks, in each and every of the 71 campuses across the country. Our currently we do admissions online, and that has increased efficiency, and it has also reduced the time that a person would take to do to be admitted in KMTC. Our admissions are in March and in September. That is when students get into KMTC. However, throughout the year, a student, a prospective student, or somebody who wants to join KMTC can walk into any campus, and they will be assisted to apply and be scheduled for the next intake that is taking place. And I want to say that KMTC is an equal opportunity place for anybody who would want to do a course in health, in the health sector.
Okay.
Yes.
All right. Dr. Kelly Oluoch, Deputy Director of Finance Planning and Administration at KMTC, and Terry Jepchirchir Chelimo, who is a physical therapist and women health pelvic floor specialist. Thank you for your time, and all the best to you as you go further into your career, and help us in excelling the UHC coverage, which we hope will be rolled out by 2020 as the government has said. Well, time to say goodbye. It has been a health, or rather NTV Today. My name is Gladys Gashan.